So, today we're going to dive straight into some treatments and lifestyle modifications to help you combat dry eye. Now, around 1 in 3 people in the UK have been officially diagnosed with dry eye, and this is a figure that's almost doubled in the last 12 months. Yet, despite its prevalence, recent studies have highlighted that public knowledge and understanding about dry eye is severely lacking. And that's not your fault, because for a long time, we as the medical community view dry eye as a relatively minor inconvenience, but we now know differently. In recent years, as dry eye rates has been climbing and research has been progressing, we've come to recognise that dry eye disease is far from simple. In fact, it's chronic, it's progressive and multifactorial, and we're now seeing it across all age groups and all genders. We also know it can have a huge impact on people's lives and well-being. Some people are unable to continue with their jobs due to the discomfort and visual issues that you can get with dry eye. But fortunately, we are now learning many more measures that we can take to slow the progression of dry eye and maybe even prevent it from occurring in the first place. It's now coming to light that if we care for our eyes daily in a similar way that we care for our teeth, we may be able to slow or prevent the severity of dry eye. And today, I'm going to walk you through some ways that you can do that. But first things first, what is dry eye? Well, this is the most recent definition. It was released in July of 2017, a multifactorial disease of the ocular surface characterised by a loss of homeostasis of the tear film and accompanied by ocular symptoms in which tear film instability and hyperosmolarity, ocular surface inflammation and damage, and neurosensory abnormalities play etiological roles. Now, I'm not telling you this to memorise it, but just to simply illustrate the complexity of dry eye disease and why a lot of eye care professionals just can't or haven't got the time to really devote to assist patients with some appropriate treatment. And I think it's actually said that it takes around 10 years for something confirmed or realised in research to actually become a standard of care. So we can only hope that one day treating dry eye will become as common as treating eyesight. So what I want to do now is try and simplify the concept of dry eye for you, because to really help your symptoms, you need to kind of have an understanding of what's going on. So here's the science bit. To try and simplify the concept, it's important to have an understanding of the tear film, because dry eye occurs in its most basic level when there's a disruption to the delicately balanced tear film. Now, the tear film has 3 layers. I mean, in reality, it's more like a soup. But for simplicity, we have the top layer, the lipid layer, that's a yellow layer there, and this consists of oils produced by glands in the upper and the lower lids. And this lipid layer prevents your tears underneath from evaporating. Then we have the blue aqueous layer, this is the middle layer, and this is the watery layer, and it's produced by the lacrimal gland. And then we have the green layer at the bottom, this is the mucin layer, and it binds the aqueous layer to the surface of the cornea. Now, essentially, there are 3 different types of dry eye, or in fact 2 distinct types of dry eye, and then a third type, which is really a combination of the first 2. So let's start with evaporative dry eye disease, because this is the most prevalent type of dry eye disease and essentially results from blocked or poor performing Meibonium glands in your eyelids. And this is a condition known as Meibonium gland dysfunction. Now, the Meibonium glands, as you can see on the image there, are those long tube-like structures in the upper and lower eyelids. And every time we blink, these glands produce oil, and the oil becomes the lipid layer of the tear film. And as I said earlier, that lipid layer is super important because it is this layer which prevents the tears underneath from evaporating. Now, around 90% of dry eye sufferers will have some form of Meibonium gland dysfunction. So if you suffer with dry eye, there is a very high likelihood that you have Meibonium gland dysfunction. So ironically, your eyes produce enough water. What they don't produce is enough oil, so your tears evaporate too quickly. Now, Meibonium glands can be damaged or clogged in a number of ways: excessive screen time, infrequent blinking, eye injuries, surgeries, things like rosacea and diet, and many others. And often in the very, very early stages, Meibonium gland dysfunction goes unnoticed because there's not many symptoms. But over time, the glands may actually atrophy, and then dry eye can become a lot more symptomatic and much more difficult to treat. So really, it's crucial to act promptly at this stage to prevent the disease from progressing further. So then we have aqueous deficient. So this is the second type of dry eye. And this occurs when you don't produce enough tears or water from the lacrimal gland, which contributes that middle aqueous layer. And this is probably what years ago dry eye was traditionally believed to be, a lack of water, hence its name. But in reality, only around 10%, some studies suggest even less than this, but around 10% of individuals experience aqueous deficiency dry eye in isolation. And of those who do, they will either have Sjogren's related or non-Sjogren's related. Now, Sjogren's disease is an autoimmune disease that attacks all the fluid-producing glands of the body, like the lacrimal glands and the salivary glands. So people very often get very, very dry mouth, dry skin, dry eyes with this condition. And non-Sjogren's related is most commonly associated with certain medications and autoimmune diseases like rheumatoid arthritis, which again can attack the glands like the lacrimal gland. And also, as we get a little bit older, our lacrimal gland tends to work less efficiently as well. And then there's combination dry eye, and this is where you suffer a bit of both. Now, we can't really talk about dry eye without talking about two major conditions really that make dry eyes worse, and they are rosacea and demodex. Now, rosacea is a very common skin condition, which is characterized by facial redness and small blood vessels on the cheeks and on the nose. And many, many people with facial rosacea also have ocular rosacea. And this is where those irregular blood vessels move to the eyelids, as you can see on this second image here. And these blood vessels introduce inflammatory agents into the tears, and this contributes to Meibonium gland dysfunction. Then we have demodex. Now, demodex are small parasitic mites that live in the hair follicles of your face and your eyelashes, and it is normal to have these. The issue is really when they overpopulate, because this can then start causing problems. Now, the risk of demodex overpopulating or an infestation of demodex increases with age. And it's been suggested that around 80 to 100% of people over the age of 70 will have an infestation of demodex. And these mites can sort of physically obstruct the Meibonium glands, leading to Meibonium gland dysfunction. So what are some of the most common symptoms of dry eye? Well, dry eye symptoms can really be categorized into three different groups. We've got the discomfort symptoms. This is like your grittiness, your scratchiness, pain, dryness, irritation, foreign body sensation, and heaviness that need just to close your eyes. Then we have the blurred vision component. Dry eye can reduce visual clarity by up to 40%. Now, while many patients may have perfect vision on sort of standard eye tests, they often struggle with daily tasks due to the fluctuating clarity that's caused by dry eyes. I mean, it's a bit like sort of driving with a smudged windshield. And then we have the aesthetic components of dry eye, the red eyes, the red lids, the swelling, inflammation, the excessive watering, tearing. It's important to note, really, in the early stages of the disease, you may not experience any of these symptoms. And as it progresses, you may experience some or all of them. But I think one of the complex things about dry eye, and what can sometimes make it difficult to diagnose and manage, is that dry eye symptoms don't always match the severity of the disease. Some people might have extreme discomfort, other people may just have blurred vision. You know, this difference in symptoms and the severity can make it difficult. Okay, so I'm just going to talk about some of the common questions that people ask me. Can dry eye be cured? Well, the reality is a bit like blood pressure, diabetes, glaucoma. Unfortunately, there's no magic cure for dry eye disease. and it's different for everybody. It's really just ongoing treatments, lifestyle changes, modifications to prevent its progression. But with appropriate treatment, significant improvements in symptoms are possible and people can live very, very normal lives. But it's important just to reiterate that dry eye disease is chronic and it's progressive. And if left untreated, it will get worse over time. And if it remains unaddressed for too long, it may complicate procedures like cataract surgery and things like that in the future. So it is vital to manage dry eye as early as possible. Now, while there's no complete cure, there are now advances in practice treatments like Optilight IPL, which can offer longer term reduction in both signs and symptoms of dry eye by addressing the underlying causes of the disease. And I will talk about this later on. So can dry eye be prevented, or, can it not occur in the first place? Well, I believe so, yes. I mean, we are now beginning to understand that daily lid hygiene can absolutely help prevent the loss of, Meibonium gland function, those little oil-producing glands in the eyelids, really in the same way that toothbrushing can help prevent the premature loss of teeth. Years ago, before oral hygiene was understood, people were losing their teeth in their 20s and 30s. So one of the things I am going to share today is a lid hygiene routine that can provide benefits to different types of dry eye, but also help prevent dry eye from occurring in the first place. And I'll also be touching on lifestyle factors and exciting new in-practice treatments. So let's begin. What factors contribute to dry eyes? Now, the factors I'm going to talk about today are those factors that you can change or you can do something about. And that's diet, sleep, makeup, environmental conditions, digital devices, contact lenses, weather, and allergies. So I'm going to just talk about each one of those factors individually and share tips to assist you in minimizing the impact of each factor. So first of all, diet. Diet is a crucial component of general health, and eye health is no different. A healthy gut supports a strong immune system, and this is essential in reducing or the inflammation that can cause dry eye disease. And really the core nutrients that our eyes and lacrimal glands need for optimal performance are water and omega-3. So these 5 steps can help really improve your eye health. So first of all, drinking plenty of water, at least 8 glasses throughout the day to aid your general hydration. And then consuming plenty of omega-rich foods like fish and nuts, as omega-3s are the building blocks of healthy tears and help to reduce inflammation. In fact, a recent study showed that women who ate 2 servings of oily fish a week had much less dry eye than women who didn't. There are also fish-free sources of omega-3 like eggs, flaxseed oil, walnuts, and dark leafy greens. Another thing you can do to help yourself is to adopt an anti-inflammatory diet. So these are foods which reduce inflammation in the body. So your rainbow diet, lots of different coloured fruits and veg, again, dark leafy greens, nuts, seeds, and your oily fish. And what you want to really avoid are those inflammatory foods which can trigger inflammation, like gluten, high sugar content foods, too much dairy, processed foods, and any artificial food additives. And then avoiding alcohol or minimizing alcohol. A recent report has shown that alcohol can increase the level of inflammation in the tear film, contributing to dry eye. Although unfortunately, ladies, the specific effects of alcohol on dry eye have been shown to be more prevalent in women. So the next thing to talk about is sleep. Sleep deprivation has been shown to worsen the signs and symptoms of dry eye, and quality sleep really is an essential part of eye health. and especially vital when dealing with dry eye for a few main reasons, really. When our eyes are closed, they're not exposed to external factors like wind, dust, digital screens, all of those things that can intensify dry eye symptoms. When our eyes are closed, the tears aren't evaporating, and the tear film has that time to evenly redistribute and stabilize across the ocular surface. And of course, during sleep, our body undergoes essential repair and maintenance processes, and debris and potential infectious agents can be cleared out. So, really, you do want to try and get your 7 to 9 hours of sleep a night. This can really help your dry eye symptoms. Now, on a related note, if you find that your eyes are worse first thing in the morning, if you're sort of waking up and your eyes are dry, gritty, and scratchy, there's typically two main causes for this. The first one is something called nocturnal lagophthalmos. And this is a condition where the eyelids don't fully close during sleep. And it can only be like a sliver of the eye can be open, but it exposes the cornea, and this can increase the evaporation of the tears, causing those symptoms of dry eye. And the other one is blepharitis. And blepharitis is when there is an overgrowth of bacteria on the eyelids and the lashes, and bacteria are more active at night. Now, the symptoms of blepharitis typically include sort of crusty eyes, recurring styes, and redness along the inner rim of the eyelids. So if you do find that your eyes are most uncomfortable first thing in the morning, there are a few things you can do. If it's down to nocturnal lagophthalmos, and again, this is something that your optometrist will be able to check for you, using a thick gel or ointment like Hygiene Night adds that extra layer of protection at night. You can also have a humidifier, which adds moisture to the air in your bedroom. That can also be really helpful. You can sleep with a sleep mask on just to give an extra bit of protection. If you have quite severe nocturnal lagophthalmos, you may need a stronger, if you like, mask. So iSil's 4.0 moisture mask is a really, really good one because it locks in that moisture at night. If your eyes are worse in the morning due to blepharitis, then it's really important to clean your eyelids twice a day with specialist lid wipes, which can help in removing that excess bacteria. So the next thing to talk about really is makeup and dry eye, because a lot of makeup and skincare products can affect the delicate skin and the glands around the eyes. So it's important to try and find brands with eye-friendly ingredients. Now, the brands I use personally, and again, depending on if you've got allergies and things like that to specific ingredients, it's important that you do your own research into this. But I quite like Butterfly's Eye Care and also Eyes Are the Story. So a few makeup tips for you to further protect your eyes is to really try and avoid glittery eyeshadows, because they can create microscopic scratches on the eye, leading to more redness, irritation, inflammation. So it's better to choose a cream eyeshadow because this is less likely to disrupt the tear film. To try and avoid eyelash extensions. The glue in eyelash extensions can cause some irritation. We also know very often people who have lash extensions try and keep them for as long as possible and often don't clean them properly, which can lead to a buildup of bacteria. We also now know that the optimal lash length is a third of the width of the eye, and this optimal lash length helps prevent the tear evaporation and protect the eye from dust. Any longer than this, and it stops the lashes doing their jobs properly. So this current trend of super long lashes is not great really for anybody's eyes, and can be storing up some issues in the future, perhaps for the younger generation. Okay. Also, it's best to try and avoid applying eyeliner on that inside of the lower lids, because this is sort of covering those Meibonium glands. That can cause a few issues and also allow the makeup particles to drift into your tear film, which you want to avoid. Mascaras, be careful with mascara. Waterproof mascara, although it might seem like a great solution for watery eyes, sometimes the waxes and chemicals that are used in them can make your lashes brittle and are not always great for your Meibonium glands. And also lengthening mascara. A lot of lengthening mascara contains something called nylon fiber. And there was a recent case of a lady who had 6 1mm black nylon fibers stuck into her conjunctiva, causing inflammation, and it needed surgical removal. So just so you know, nylon fibers under a microscope can look like tiny little needles. So you really want to be avoiding anything like this in your mascara. When you do use mascara, try and apply it on the mid to the ends of the lashes rather than going right down to the root by those tiny glands. And it's also really, really important to replace mascara or indeed any wet makeup like liquid eyeliner really every 3 months. Or, as soon as if you see your mascara become clumpy before that stage, get rid of it. This wet makeup can be a breeding ground for bacteria, and things like demodex mites love mascara and they can live in it for around 5 days. And also, really, really important to make sure you clean your makeup brushes weekly and remove all makeup every night. The next thing to talk about is digital devices, because you know what? Digital device use plays a huge role in causing and making dry eye worse. And I know it's so hard to avoid. So many of us work on screens all day long, but one of the main reasons why this can make dry eye worse is because of what's called reduced blinking and also partial blinking. Now, when we're in normal conversation, it's said that we blink between 12 and 20 times a minute. When we're on digital devices, our phones, our computers, this drops to 5 times a minute. And apparently in gamers, it can go as low as 2 times a minute, the sort of blink and you'll miss it mentality. In addition, not only do we not blink as fully, not only do we not blink as much, we also don't blink as fully. So we don't fully close our eyes when we're staring at a screen. And blinking, as I'm going to touch on later, triggers the Meibonium glands to produce the oil. So if we're blinking less, we're not getting those oils released into the tear film. And so the vicious cycle really of dry eye begins. So what can we do? Because so many of us today rely on digital devices for work. So, there's a few things that we can do. And the first one is making sure we set up our workspace as best we can to help alleviate the symptoms. So firstly, we want to keep our monitor as far away as possible, around arm's length at least. And we also want the top of our computer monitor at eye level or slightly lower, because this exposes less of the eye to the screen. So in image 1 there, you've got an eye that's looking up at a screen and you can see a lot more of it is exposed. Image 2, it's looking straight ahead, and image 3, it's looking slightly downwards. So you can see in image 3, less of the eye is exposed. So this can help symptoms a lot. It's also important to take regular breaks, not to be staring at that screen for long periods of time. The 20-20-20 rule, nice simple rule, every 20 minutes, take 20 seconds to look 20 feet away. And at the same time, you might want to do some full blinking exercises, get those lid muscles and Meibonium glands working. You might get a few funny looks at work, but if anyone asks you what you're doing, tell them, because actually it might help them too. So a few other things you can do if you're on a screen is getting some computer-specific glasses, because any reduction in eye strain is going to help alleviate some of those dry eye symptoms too. You can invest in a small desk humidifier to help add moisture to the air. I think you can get these from Amazon. And then you're keeping preservative-free artificial tears on hand, or a spray, just to keep your eyes feeling fresh and hydrated throughout the day. Next, I want to bring your attention to contact lenses, because the improper use of contact lenses, especially overwear or sleeping in contact lenses, is a major contributor to dry eye. Now, the 3 key steps to your contact lens care include never ever sleep in contact lenses. This is one of the primary causes of corneal ulcers and abrasions. It's important to know that contact lenses are medical devices and should be treated with respect. Infections related to contact lenses can really take you out of your contact lenses for weeks at best, or at worst, really threaten your sight. Always dispose of contact lenses as instructed and clean your contact lenses very, very well. In fact, if you do suffer the early stages of dry eye, it might be worth considering shifting from a monthly to a daily contact lens and reducing your wearing time, because really daily contact lenses are thinner. They allow the tear film to nourish the cornea more effectively. And lastly, let's talk about seasonal weather and changes and allergies, because every season brings new factors that can further irritate dry eyes. And it's important, especially if you suffer with dry eye, to reduce your exposure to these factors. In the summer, we have allergens like pollen, which can contribute to dry eye and also cause itching and discomfort. So in the summer months, some tips are: keep your artificial tears in the fridge. The cornea has more cold receptors than pain or itch receptors. So when we apply something cold, it can help lessen the sensation of itching or pain. An artificial tear with an antihistamine or an anti-itch component to it can be really useful in the summer. And also, if you use an oral antihistamine or an over-the-counter oral antihistamine for your hay fever, if you have it, this can make dry eyes worse. So it might be worth chatting to your GP about an alternative for you. Cold compresses can also be really, really nice. We have a lovely one from Brooder, and this can help alleviate itching and inflammation. It's also really nice to use post-surgery. You can purchase dust mite, allergen control pillowcases, and consider an air purifier for your home to reduce those allergens. And it's really important when you're out and about to wear full coverage sunglasses to prevent the pollen from making contact with your eyes. And then we have the winter months. Key things here are the heating and the cold, harsh winds, which can put pressure on those Meibonium glands. So in the winter months, you really want to make sure you're hydrated. You want to increase the humidity in your environment. So you can invest in a room-size humidifier for the room you're in most during the day, and then move it into your bedroom at night. So this can counteract the drying effect of heating. You might want to change up your artificial tears in the winter and move to a gel-based artificial tear, which stays in the eye longer. You can also keep these by your bedside table. And again, when you're out and about, protect your eyes from the cold by wearing your glasses or sunglasses. So what can you do on a daily basis to help soothe your dry eye? So, depending on the severity of your symptoms, this lid hygiene routine I'm about to share can be used alone. It can be used in conjunction with in-practice treatments. It can provide some help to all types of dry eye. It can help reduce the severity of dry eye. And it can even, if you don't have dry eye, it can even be used as a preventative measure. So the 4 steps are a heated mask, an eyelid cleanser, artificial tears, and a lipid supplement. And each of these 4 measures really work on the different aspects of dry eye disease. So I'm just going to share a few more details about each one. So first of all, a heated mask. A heated mask gently heats the Meibonium glands in the eyelids and helps them to release oils. So if your glands are clogged, it can help melt the oils and allow them to flow smoothly into the tear film. Now, for people who are quite symptomatic, got quite uncomfortable dry eyes, it's advised that you use a heated mask for 10 to 15 minutes a day, or even twice daily. Others may find that once weekly or once monthly is adequate really as a preventative measure. Our favourite that we use in practice is the Brooder Moist Heat Mask. And you just simply heat the mask in the microwave 20 to 30 seconds and pop it on your face for about 10 to 15 minutes. And the moist heat from the mask not only soothes the eyes and helps to liquefy those oils, but it also adds moisture to the eye. And it's a nice relaxing treatment to give yourself. Then we have an eyelid cleanser. Cleansing your lids morning and evening can help to prevent that overpopulation of bacteria, which we know contributes to inflammation, Meibonium gland dysfunction, tear film instability. Now, years ago, some people even recommend this actually. The common recommendation for cleansing the eyelids was to use diluted baby shampoo. Although one of the most important dry eye studies has revealed that baby shampoo destabilizes the tear film over time. So we no longer recommend this. Once in a while, maybe okay, but you certainly don't want to be cleansing your lids with baby shampoo on a daily basis. So there are now specialized eyelid cleansers on the market, and we do quite a few different ones in our practice. And what we would recommend would depend on your specific symptoms. But my personal top pick is Purifies. It's a hypochlorous spray, and really because it's so easy to use and it's effective against a broad spectrum of bacteria, and it mimics the body's natural defense mechanism. Our white blood cells naturally produce hypochlorous acid to combat infections and to kill off bacteria. And this particular spray has been proven to counter various eyelid issues, blepharitis, demodex mites, dry eye. And the reason I love it is because it can just be sprayed on the eyes and face. Really simple, really easy to use, and you can just spray it on 3 times a day. Then we have artificial tears. Now, artificial tears can help to alleviate the discomfort. They don't cure dry eye. They never have cured dry eye, but they can certainly help with some of the uncomfortable symptoms. Lots of different artificial tears out there. We tend to use the range called Hygiene. It's got different formulations for individual symptoms. And artificial tears really should be used a minimum of twice daily consistently. Although having said that, some of the newer in practice treatments can alleviate the need for artificial tears, sort of frequent use. And it's important with artificial tears to use preservative-free ones because our eyes are vulnerable to long-term use of preservatives. So preservative-free artificial tears. And then a lipid supplement, a high-quality, high-dose omega-3 supplement can help diminish inflammation and help to heal the eye surface. And also some studies have shown help to produce better quality oils. Many modern diets, we don't eat enough omega-3s to provide enough lipids for a stable tear films. And there's 2 different types of supplements out there. The ethyl ester form, which is simpler, more economical to produce and often cheaper to buy. And then the a triglyceride form, which is more readily available, bioavailable for the body, meaning it's better absorbed. So really for optimal results, you want to choose a triglyceride form and consume between 1,000 to 2,000 milligrams of omega-3 daily. And it can take several months of consistent omega-3 intake to observe tangible clinical benefits, as the body needs that time to assimilate these fatty acids. Now, another really simple thing that you can do to improve your eye health and dry eye is blinking exercises. And as I mentioned earlier, good, full, strong, regular blinks are vital because every time we blink fully, our Meibonium gland can release oil, spread that layer of tear across the eye, provide lubrication, and remove all the debris. Now, in today's lifestyle, we don't blink as frequently or as fully as necessary. Our tears evaporate quicker, they can clog up the glands, a buildup of stagnant oils in the Meibonium glands can occur, contributing to Meibonium gland dysfunction. Also, as we get older, our eyelid function deteriorates, our lids become more lax. So if we do these regular mindful blinking exercises, we can help keep those muscles and glands working better. So how do we do our blinking exercises? Well, first of all, you want to gently close your eyes fully, count to 2, squeeze your eyelids together, count to 2, open your eyes wide, count to 2, and relax. And then repeat this exercise 5 or 10 times in a row. Now, if your daily activities involve lots of screen time, driving, or watching television, try and practice these focused blinking exercises every hour, and it can make a difference. So what if you've tried all of these at home treatments, or just the thought of doing a daily dry eye regime for the rest of your life doesn't offer the freedom that you're looking for. For some people, despite implementing all of the things that I've spoken about today, the dry eye may have progressed too far, and it may make that very difficult to effectively manage the uncomfortable symptoms. Well, fortunately there are now newer advanced in practice treatments available that can directly target the root cause of dry eye disease. And we at Style Optic are very proud to be one of the few practices that have invested in Optilight IPL technology that really, really effectively treats dry eye. Now, it is the first and only IPL treatment that has been approved for the management of dry eye disease. And as I say, the reason we're so excited about it is because it's actually treating the underlying cause of dry eye disease rather than just the symptoms, and it is providing lasting results. So how does Optilight Intense Pulse Light work? Well, Optilight IPL delivers precise pulsed light of high intensity around the eye area. And this helps to improve the eye, the lid, the lash health, blepharitis, all of those factors which contribute to dry eye disease. And it works on a number of areas at the same time. So the light itself allows the lipids, which have solidified in the oil glands, to liquefy and flow more easily onto the tear film. It also destroys the overgrowth of bacteria and demodex mites, which cause inflammation. It can also eliminate the blood vessels that contribute to inflammation and helps reset that ocular microbiome and to more favourable conditions. And perhaps the most exciting thing about it is it promotes the regeneration of atrophied glands we previously thought were no longer working. It's actually stimulating them to regenerate, which is amazing. And as a bonus, IPL also boosts collagen, so it helps improve the blinking reflex and improve the skin around the eye area, making it appear clearer and healthier. So when can you expect results from IPL? Well, if you're the right fit for an Optilight treatment, this treatment approach can offer big improvements to dry eye symptoms in a relatively short space of time. Now, most patients require around 4 treatments scheduled 2 to 3 weeks apart, and then very often a maintenance treatment once every 6 to 12 months. And to achieve the very best results, we like to integrate our Optilight treatment with a Zest deep cleansing procedure. So what is Zest? Well, Zest is a very powerful yet gentle lid cleansing treatment using a natural ochre-based gel. And what this does is effectively kills any mites and bacteria, removes dirt and debris, some of which may have been building up for decades. Yeah, it's a bit like cleaning teeth. Even if you clean your teeth daily, you can still get a build-up of plaque, which is then removed in a dental hygiene appointment. The ingredient, ochre, as well, also boasts a very high polysaccharide content, which can help combat inflammation. And we like to do a Zest treatment as part of all of our IPL packages with our complements, as we found it just maximizes the effectiveness of IPL, and you can start feeling those lovely benefits much sooner. Now, you can also have a Zest deep cleansing treatment without IPL, particularly if you have demodex. It can also be used, much like a dental hygiene appointment, as a preventative measure. And you can have a deep cleansing treatment with Zest every 3 to 6 months, and to ensure the continued health of your eyes, and also a Zest at-home eye care kit. So, how do you know whether you have dry eye? And how do you know what treatments are right for you? So, if you do have dry eye, you may be wondering what the severity of your case is and what the best treatment path would be for you. And the answer to this is probably not straightforward, as everybody is unique and requires a specialised diagnosis and a personalised treatment plan. Well, at Style Optique, we take quite a thorough approach to the diagnostic process. So we take around an hour or so, and there's a few key things we do in a diagnostic dry eye. First of all, something called corneal topography. It's almost like mapping out the landscape of your cornea, the clear front part of your eye, and it helps us to identify the areas that are affected by dryness. We also do a tear film analysis because, your tears, as we've said before, play a vital role in eye comfort. So we evaluate their quality, see how quickly dry spots form after a blink. We assess the oiliness of your tears, and this gives us a deeper insight into the nature of your dry eye condition. We also do meibography. Now, using advanced imaging, what we do is we capture detailed photos of your meibonium glands, those tiny oil-producing glands. And this allows us to see how many are functioning at full capacity, if there's any blockages. We also will assess the quality of the oils which come from your meibonium glands and assess whether they're healthy or diseased, or if your glands are blocked. We'll also look at your blinking patterns. Are you blinking frequently and fully or not? We'll also look at your eyelids and lashes for signs of bacterial infestation and ocular rosacea. And we'll have a good long talk about your lifestyle, your environment, your daily activities, also what medications you take, what other factors might be contributing to your condition. And when we have all of these details, we then have the comprehensive information necessary to determine the type of dry eye you're experiencing, what are the potential factors that you need to work on, and devise you that personalised treatment plan. So if you think you are experiencing symptoms of dry eye symptoms, if you would like to have your eyes assessed to determine whether you do have dry eye syndrome or whether you're suitable for Optilight IPL treatment, we invite you to schedule a dry eye assessment. And as I say, assessment takes us about an hour or so, enables us to try and get to that root of the issue and tailor a treatment plan especially for you. So thank you so much for listening to this. If you check out the description, there's lots of details below about some of the products that I've mentioned on this, and also how you can book your dry eye assessment with us. Thank you.